Hello, my name is Najimu Akanji. I'm a mental health nurse practitioner student here in NKU. I'm going to talk about mental status examination. What is mental status examination? Mental status examination is a structured assessment of patients' emotional, cognitive, and behavioral functioning. There are 9 essential components of mental status examination. For the purpose of this discussion, I'm going to talk about 4 major ones, which will include mood, affect, thought process, and thought content. Mood is one of the essential components of mental status examination and is regarded as the emotional state of what the client tells you during the psychiatric evaluation, and is usually put in quotes. For instance, if the examiner asks the client about how he or she is feeling right now, patient might say, "I'm happy, I'm sad, I'm frustrated, I'm depressed." Those words should be put in quotes and documented the way it was described to you. It is considered a subjective report of patient emotional state. On the other hand, affect. This is the clinician impression of the emotional state of the client during the client and psychiatric encounter. The affect component of mental status examination enables the clinician to describe the apparent emotional state of the patient they are examining to aid diagnosis and initiate psychiatric care. It is considered objective emotional state of the patient, that is, what you observe during the patient evaluation. Some of the key areas to be mindful of when assessing an individual affect is to note how they appear, the appropriateness of their presentation, the presented range, and to determine if the affect observed matches with subjective reported mood. Also, patients, there are four qualities of affect: stability, appropriateness, intensity, congruent are some of the qualities of affect. For instance, a patient who is laughing uncontrollably about the demise of his wife during the psychiatric evaluation should be evaluated further for mental illness because such behavior is regarded as inappropriate affect. Also, patient affect should be congruent with mood. Patient affect can be documented as lay-by, flat, blunted, obtunded, congruent, incongruent. Another component of mental status examination is thought process. Thought process is referred to flow of thought, speed of thought, and as a provider, you must assess how those thoughts are formulated and expressed. A mentally stable, healthy human being thoughts should be logical, consistent, and coherent. While patients with mental illness or ongoing psychiatric disorder may present with illogical thought process, disorganized thought, absence of directed, confabulation, word salad, flight of ideas. For instance, as a provider, you might want to judge patient thought. A patient who has never owned a job for one day is reporting to you that he is the owner of the 5-star hotel and is waiting for the executive to meet him in your office. So those questions should be a concern. You should explore his thought further to make sure you properly diagnose him and initiate appropriate psychiatric care. A patient with healthy mind thoughts to be consistent, logical, and coherent. And lastly, thought content is another component of mental status examination. It is regarded as stream of thought that occupies client mind and it's considered unusual and dangerous idea which require further evaluation. Patient thought content should be taken seriously. Patients should be evaluated for suicide and homicidal ideation to rule out thought of self-harm and other. some of the time to describe patient thought is delusional, hallucination. So the reason why these thoughts should be taken seriously is because patients might perceive their thought as real. Patients might act on their thought. For instance, patient might think that there's somebody out there to get them, and he might want to defend himself. That is why sometimes you see patients that kill somebody else or trying to attack somebody because they think they are out there to get them. So as a result of this, as a provider, we must utilize effective communication skill to exploit patient thoughts and feeling so as to aid diagnosis and initiate appropriate psychiatric care to promote patient recovery and patient safety. Thank you.